A joint press conference between KRIPA Foundation, Meghalaya AIDS Control Society, doctors from Bethany Hospital and Samkhamti was held on the 9th of May 2022 to create public awareness on the need for a medical camp for drugs and alcohol users and for citizens who are above 65 years of age. Speaking to the media, the proprietor of Samkhamti, Sam Dingdor, informed that the medical camp is aimed at addressing the problems of addiction to drugs and alcohol amongst the youth. He added that the camp will be held at the premises of the Samkhamti parking lot, wherein secrecy of patients will be maintained.
Shillong bangimut man ay kini free medical camp. Camp bangila ya ngerjimut lang mentala arbanay tami de medical camp ka kami pher ni medical camp. Namar na lor jung gini ki jeng check up ki dan ko ka bolong kongsan ba ka jing iya bagi kami pa menta kani ka jok ki syam di ha ka bagi bagi drug addicts te kani ka medical camp ka bangi ay menta kande bangi dia counseling hiki drug addicts especially juvenile kita ki bilang kena te sian ka KRIPA Foundation lukan supply to ga de-addiction center jung ki for juveniles. But consider the program kani detoxification ru kani ka wen main program ni ka free medical camp te kaphang bakongsan ni bingilia ya kani ka free medical camp mangni po premises jong kasam Samkhamti kalong ba ngi kwa ban keep it very secretive ba kitu ki khna bawan there be absolute privacy dan bakte ru iki bikiwan to ka Shillong bet tang ka ji kundo lang ba preng jong ki bat ki doctor tapi haban stu ba tentang kun kini camp medical camp kamtam ko badai ban address kini drug addicts lang ile ai community hall jong Shillong jong ki kamtot mo ang kasim jing ba ki bikin wan markan sa arise keto ka stigmatization pikir kin sule rani ban wan tidak ka ba ngi yatim lang pada kini likely ki ka KRIPA Foundation ka Max bagi doktor jong Bethany Society ngile lang ti po Samkhamti parking lot jong institution din tingi promise ru iki bakan dan bagi absolute privacy katay di thang.
While giving details of the proposed camp, one of the members of KRIPA Foundation, Sharat Walang, said that the medical camp has been organized for the first time for victims of drugs and alcohol addiction and also for senior citizens who require medical attention.
So Samkhamti, in collaboration with KRIPA Foundation De-Addiction Center for Juveniles, KRIPA Victoria Senior Citizen Home, KRIPA Foundation IRCA, Bethany Hospitals and Meghalaya AIDS Control Society. This is the first medical camp pertaining to drug alcohol abuse, a platform for women above the age of 65 to be enrolled into a private senior citizen home and a general medical screening for all. The number of cases, since you had asked me, sir, about the number of cases in de-addiction center of juveniles. So the number of cases admitted to KRIPA De-Addiction Center for Juveniles have been alarming since its opening in July 2021. We have taken care of till March 2022, from July last year till now. We have taken care of 45 IPD cases and close to about 60 OPD cases. So that is quite an alarming number. As of now, from the Nongmansong police station, we have almost about 60 under 18 users that are yet to be enrolled in our program. The reason why we are unable to admit them right now is because we are already full. We have more than 15, soon I think 19. We had to increase the number of beds, so we are totally full right now, right? So the age group is decreasing drastically, and we as KRIPA Foundation are trying our best to raise awareness in hotspot areas as much as we can. The reason why we teamed up with Samkhamti is because that particular belt is a hotspot area. Right, so the number of users, number of cases that are rising, even from the peddlers, it is absolutely alarming. So we picked that area so that it is, so to speak, enforced that this particular camp is actually happening, and they have that offset to be part and parcel of that program. See, today, for example, there was an organization that came by. We've decided to also enroll them. There'll be a TB, tuberculosis test, that will be done in the morning for spot test, or people who come in the evening can register and get the test done the next day or at a later date. So an HIV screening test will also be conducted in this program. Right, so why are we doing multiple various tests? Like there's a dental, there's an HIV detoxification. Reason is because if we do a specific particular camp for, let's say, only detoxification counseling, then there's just a certain number of people will come. It becomes a little more stigmatizing, and there's taboo related. But when we give a general treatment to all, the advantage is that now their parents can come in for an eye test, but also send their kids for HIV test, or be it any other test related to drug or alcohol abuse. Now the highlight of this camp goes to a certain individual who is taking up the initiative to take a bold step forward, which is Mr. Sam. He is very much, as people who are aware, he is very much from the liquor industry, but he is stepping up to fight addiction related ailments. This is a tremendous landmark in Meghalaya, and this is an honest implication that corporate social responsibility exists in direct relation to the field that they are working in. For instance, liquor companies, retail outlets promote their sales through, let's say, music events, festivals, tourism-related activities. But for Mr. Sam to take up this initiative is very courageous, right? So you had some questions about who will be paying for the medical camp, etc. So a request to all participants for this program to please bring their BPL or ration cards, or a letter from the Rangba Shnong, respective of the Dorbar Shnong, to avail all services free of cost, such as consultation, investigation and medicines. Right? So investigations are like blood samples, urine samples, etc. The rest of the public will receive consultations for free. However, investigations and medicines will be charged at a very nominal rate. Like the doctor had suggested earlier, that there'll be some free samples. Those will be availed for free. And any medicines that we receive for free from companies or from the government, those will be specifically given out for free. So the ones that let's say, government or the companies have not given it to us for free, those will be charged, not at MRP, but probably lesser at distribution price.